Oh no. Well,
Oh Lord,
that
what have you
actually
done?
wasn't meant to be there. There is a hidden layer that has appeared on this that has miraculously started introducing a topic that should not have been introduced yet.
Laurie's
So,
gone into a
hello
dump
everyone.
truck.
So, hello everyone. Welcome to the live stream. Thank you very much for tuning in. I apologise, that was probably a very odd way to start the live stream. Unfortunately, we did have a hidden layer. That is something that will come later. That's actually a lot of progress on our new site, which is really, really good. But
Laurie, I thought
today,
I thought they were building my funeral pyre there. Well, wasn't that getting
we're
ready for
trying.
my?
We're
Okay.
certainly trying. Yeah.
Cool. Off you go, man.
So it's been an incredibly busy week for us here at Wildlife Aid over the past 2 weeks, actually, since the last one. Hopefully we won't have any more technical issues with this one, but if we do, blame Simon on that one, because it's probably his fault. It wasn't last time, but I'm going to say it is anyway. It's been very, very busy. We've seen a whole load of patients come through. We will be getting to those and updates on a whole load of patients and rescues, and an update on the new centre, which I know a lot of you are interested in. But for the time being, we're joined by a very, very special guest at the moment, and I will pass you over to Simon to introduce said special guest.
I can't think of anybody special, Laurie. Can you think of anybody special? I mean, to work here, you have to be insane. You have to be elderly. Well, she's not that, so that doesn't work. Insane probably is, but no. We've managed to pull her away, and I got a horrible text about 20 minutes ago saying, I can't do tonight, I can't do it, we're too busy. So I just churned back saying, it's got to happen because you've been introduced, and it is, of course, Sally, our new veterinary surgeon. Here she is, she's smiling, look, let's capture that image because she's not always smiling. Sally, it's been a bit of a baptism of fire for you, hasn't it, really?
It has, definitely.
Have you enjoyed the baptism of fire, or are you still struggling to a small degree?
No, I'm enjoying it. It's going to take a while to get up to speed. I'm definitely increasing in my speed, but there's a lot of room to go yet.
Yeah. So just give us a bit of history of you, because you've done all sorts of things in your life, haven't you? What did you start off doing when you first became job worthy, as it were?
So originally, first time round, I was good at maths at school, so they said I should be an accountant. So I was an accountant, but I didn't really like it, to be honest. And I worked with cat rescue charity for about 15 years, so I knew I wanted to work with animals. And then I decided, okay, I'd like to be a vet. So I went back to vet school in my late 30s. And graduated in my early 40s.
That's a pretty brave thing to do, isn't it? I mean, to go back to vet school, I mean, I would love to be a vet, but I'd die before I finished the course. But I mean, to go back to university and have to do all that learning again, was that a struggle for you?
It was. I think that the youngsters have a big advantage. I think their brains are far more like sponges. I feel like it took me a lot longer to remember the absolutely huge volume of material you have to learn at vet school. But yeah, it was okay. I didn't have time for socialising, so I think that sort of shows. Like the youngsters managed to fit in the socialising as well as the studying, but for me it was pretty much just studying solid for 5 years.
But you'd been a volunteer here before you did all that, hadn't you?
Yeah, I've been here for about 7 years now. So and I was very lucky when I started, when Lucy was in charge of the hospital. She very quickly pulled me in to be an auxiliary. So I've been on the vet team for the majority of that time. So yeah, I've been quite lucky.
But can we still say at this stage in the game, maybe not in a month's time, but are you still enjoying it at the moment?
Oh God, yeah, I love it. I wouldn't have it any other way.
Cool.
Ask me again in a month, I might change my mind.
Yeah, no, I won't ask you again. It scares me too much. You might give me the wrong answer. So we've got Sally, who's leading the vet team now. We've got Tim, who has joined as another full-time vet. So we've got two full-time vets. The trouble we have here is trying to tell them that they don't have to work 7 days a week, both of them. The whole idea we did that was to give them sort of a couple of days off every week. Sally has taken no notice of me at all. It's very sad when you get old because people say, yeah, Simon, yes, and they take no notice. I find them totally ignored. It's pretty full on though, isn't it, at the moment for you?
It is very full on. I mean, the admits just keep you busy through till the end of your shift, and then you've got all the other things that you need to do with inpatients, so it's pretty full on.
So what's your sort of book like every day when you've got to inject things and check things? What sort of length of book have you got? How many patients have you got you're looking at every single day?
My average daily list on top of the new admits is anything from sort of 12 up to 20 depending on the day. And that's for stuff to do, and then there's patients on top of that. There's patients that have finished a course, their initial course of medication, who need a review and decide whether we need to continue with treatment, finish treatment, or start a different treatment. So it's quite a lot to get through each day.
And how many patients are you getting in a day on average at the moment? And this is patients, not just in a group of 5 babies would be 5 patients to me. So how many patients roughly are you seeing a day?
I would guess probably the average at the moment is about 45 patients. I think yesterday, day before yesterday, we had 49 patients up till 6 p.m. and then I think there was another 10 admits after that, which probably translates to another dozen or so on top of that. And I understand that our highest patient number was 80, so there's more to look forward to.
Yeah, and with really, I suppose we could say we're possibly an eighth of the way through orphan season now. We've still got a long way to go, haven't we? And with this weather and this dry weather, I know we can get some rain over the next couple of days, but it's going to get drier and drier, which obviously is a problem for animals in themselves, because you'll probably be seeing more fly strike patients.
Yep, get the old maggot suction machine out again. We have a surgical suction, but I wouldn't ever use it for surgical suction because it's always just being used for removing maggots. It's pretty effective.
Grotty. So, what's the most exciting so far? What's the thing which, before you came here to be the vet, when you were just doing your side stuff, now you are the vet, what do you find your biggest challenge?
So I think my biggest challenge is I think as for most vets, is new stuff that you haven't seen before. And not having Mary to fall back on to say, what's this? Although I lie, I can fall back on her, and I do still. She's very kindly allowing me to still email her with problems, and we have other sort of consultants on board as well that we can email with issues. But I don't know. I think I always feel failure is the wrong word, but I always feel like I should know more. But it's a life learning job, and it's still I'm only a year and a bit out of vet school now, so got lots to learn.
So far it's going okay.
If
anybody's got any questions for Sally, make them wildlife questions, not about your domestic pet, please. I'm sure she'd be happy to answer questions, which we can. I can tell her via my earpiece with Laurie. I can hear Laurie. Sally can't. So if we get a question, I shall have to relay it to him. So if we get those guys, if you've got any questions, please don't hesitate to ask us. But interesting life. Sally's got a long orphan season ahead of her. Poor old Tim, who had never really worked that much with wildlife, I don't think, had he, has come into, it was worse than the baptism fire. I said, well, I want to go home at 9. Yeah, okay. So what's your average going home time, Sally? Just tell everybody out there what sort of stupid hours
you're being brutally honest, I tend to get in for 8 so I can set up, even though start time's kind of 9. And on average, I say I probably am leaving at 10 p.m. most days.
Oh, Sally, you're lying to Sai, aren't you?
No.
Do you want to be honest what time you normally leave now? Because I have my cameras I can watch all the time.
There have been occasions when it's been 11 p.m. and the other night it was 1 a.m. I think. But that was exceptional. I think there's only other one time when I've been here beyond midnight. But the evening teams are fantastic. So many of the team leaders, bless them, because they know that even though I'm in my 40s, I'm scared of the dark. So I don't like being at the hospital by myself. So many of the team leaders will stay on with me. They're all fantastic, and some of the people in my team will stay back as well. They're really good.
So, of all the patients you're seeing at the moment, what sort of percentage would you have to plonk on being human caused, either indirectly or directly? What sort of percentage are you saying is because of mankind in some way or another?
At the moment, probably at least more than 50% man-made, and most of that's indirect at the moment because obviously with baby bird season in full swing and the bird shed absolutely packed to the rafters, there's a hell of a lot of cat attacks in there. So birds come in with puncture wounds, bruises, lacerations, and unfortunately the actual size of the laceration itself might be quite small, but because the patient is small it ends up being a massive wound on a tiny bird. We're still getting the usual number of RTAs. We've had a hell of a lot of RTA hedgehogs over the last month, and the old RTA fox as well. We've even had some poisoning. We had a slug bait poisoning hedgehog in, I think, about 10 days ago, who, fingers crossed, so far is doing quite well.
Cool.
But we still don't have final answer on that one.
So, how many birds have we got up in the bird shed at the moment, roughly, would you reckon?
Oh my goodness, I'm really rubbish at...
Guess it.
Guess it? Well, 15 incubators times... Let's say 15 incubators times 4, whatever that is.
That's 200.
And then maybe your... flight cages, 2, 4, 6 times 6 as well, so I had another 36 and then another 4 in there. It's probably about that much, whatever that works out at.
It's pretty good because Sally used to be an accountant and she hasn't quite got those numbers to her fingertips.
Can't do mental maths anymore.
So I mean, one particular thing I think people understand, if they find a sort of a baby bird in a cat's mouth, why is it so important that they bring it in to us? What's so special about a cat victim bird?
So cats have bacteria in their mouths. There's lots and lots of different kinds of bacteria in there, but Pasteurellas are one of the really nasty ones. And unfortunately, it's that thing where even if there isn't an obvious wound on a bird, the cat's teeth can just cause the tiniest wound on there, and once that bacteria is in the bird, it will kill them. So as a vet, obviously I'm really not a fan of any prophylactic medicine, meaning giving medication if it's not absolutely needed, giving it to prevent something, except for worming obviously and defleeing your pets. But with cat attack birds, we always, whether or not we find wounds, give them a short course of antibiotics, which we know from bitter experience back in days when we didn't. If you don't, they will die within a couple of days. So it's
always
important.
tricky. So lots and lots to do. I mean, when you think, we worked out the other day that we're using something like 30. Is it 30? No, 3. Was it 100 syringes, 101 mil syringes? Because most of the birds are tiny, so they need a tiny amount of injection. But not only do we inject with that, but we feed with that as well. And we're using something like, I think it's 100 syringes a day, 101 mil syringes a day.
Yeah, it's a lot. I mean, I'm aware certainly in the treatment room, just us in there, we're getting through more than one whole box a day by far. And gloves as well. I'll personally get it's an environmental disaster. I get through more than one box of gloves a day. Although I must be honest, this last couple of days it's been so darn hot. I've just been washing my hands between patients because I just can't. Once you've stepped out of one pair of gloves, you can't get the next pair of gloves on.
No, absolutely.
Hands
It's
are too sweaty.
difficult. I think we got a question from YouTube. Laurie was talking to me at the same time you were talking to me, so I was completely screwed. But let's him ask me a question again, and I will try to relay it across. So basically, in a nutshell, because Laurie does things not in nutshells, what's the main thing to be considered between wildlife medicine and domestic medicine? What do you think are the biggest differences?
Well, I think one of the biggest difference is you don't have an owner to tell you what's wrong with the patient. So, for example, if you're in a pet practice, your least favourite admit would be a dog where the owner says it's not quite right. You're like, well, where do I start? Which body system am I looking at? And with birds, for example, the same translation is not flying. It's like, well, that could be anything, couldn't it? So not having a history is often difficult. It's really useful when people are able to provide one, but it's usually found on ground or not flying for birds, which is unhelpful, really. I mean, you know, the finder can't do anything about it. They've only spotted the bird for 1 minute. I'm not blaming them at all. But I think that's one of the biggest differences, really. But also, I think by far one of the biggest problems that we have with wildlife is the levels of stress in terms of welfare. So whereas with a pet animal you can go to pretty much most extremes to fix your patient and to do things, and you've got an owner to look out for it. Many species, feral pigeons cope really well, generally speaking, with a lot of handling, so you can do quite a lot of stuff with them. But when you look at even just a wood pigeon for a comparison, they're really stressy birds. So what we might do for a feral pigeon, we can't necessarily do for a wood pigeon on welfare grounds, because you have to primarily always think of the welfare of the patient. So that's really difficult, being able to balance the stress and minimising handling with your patients, because every interaction that wildlife has with people, even if it's just seeing you, is stressful. So we always have to be balancing that, sort of trying to fix your patient with the stress and the impact of that on their welfare.
So really, your job's quite easy, isn't it? You just dawdle around. I mean, if ever I want Sally, she's sitting up by the pond having a bit of lunch or a bit of this other, and I tried to find her just now. She was actually hiding from me. I saw her with the telescope, making sure that I couldn't see her. I mean, we've got so much going on. I mean, Sally, this is the one big thing. You know, everybody says, oh, well, animals don't have a voice. I actually qualify that, because domestic animals do have a voice through their owners, but wildlife has no voice. So when everybody says, oh, you know, give the animals a voice, actually domestic animals do have quite a strong voice. And as you can hear from my dogs barking in the background, but wildlife doesn't. So we've got to do so much guessing. We've got to try to work out what happened and why, which is why when I wrote my book, Owl's Dream, or whatever I call it, the Owl with the Golden Heart, I forgot what it's called now. But you know, you can work out what happens as soon as you get the animal, but you've got to work out why that animal got into the position it was. And it's exactly the same for Sally. An animal comes in, it's plonked on a table, and she knows nothing. I mean, you've got to really just try to think it through and sort of think backwards how it could have got like that. And it's a bit of a challenge for you, I suspect, and the challenge will be with you forever. I mean, you do realise now you've started here that you're not allowed to leave until you're in a box, don't you? You do realise this is forever.
I hope
forever.
so.
Look what's happened to me. I'm 27 and I look older than Sally. It's quite scary, to be honest. Now we've got some interesting people. We've got Sven, who's donated 100 quid. Sven, thank you very much.
Thank you.
We do have an opportunity, Sally, now, because if you're short of any CCTV work or anything you want electricity-wise, our electrician is actually in the chat tonight.
A CCTV guy, not electrician.
So I'm going to embarrass him tremendously by saying I'll give him I see. Again, this is what happens. I give him a list of things I want to do, and he says yes, Simon. Nothing happens. But if Sally asks, I know he's going to do it for you. So if you've got any questions for him, he's brilliant. I mean, he comes down at a drop of a hat. He keeps all our CCTV going. He's doing all our electrics at 20 acres, which is a mammoth job. I mean, he's got so much to do on there. It's huge. And we'll see a bit of probably 20 acres later on. Have you been down there recently, Sally, or not?
I haven't. I still need to find a day to get a visit in. Very excited.
5 minutes. I do drive very fast. So tomorrow, Sally and I are going to 20 acres to have a look. And if she upsets me, I'm just going to drive straight into one of the lakes. You know,
can I also interrupt here and just say that Simon, every time we go down to the new site, seems to treat it like a...
Laurie, I've tried so many times to bump you off as we drive down there by going over the best bumps, but it will happen one day. I will get my own back. It's coming on well. I don't know whether at this point we can have a quick look. Laurie, is this a good time to do this, or do we need to do other stuff first? I've got to talk a bit. Laurie says I've got to talk for a little bit, so we'll just talk about absolute rubbish.
It's fine.
Yeah. So here we are. So we've got some photos. So this is the sort of kit that arrived. We've got over sort of 2 million quid of the kit at 20 acres. Those big collective, what are they called? Yeah, what are they called, Laurie? Dump trucks, that's it. They take up to 50 tons. The dozers obviously push everything around. Laurie is desperate to get a go on a dozer, and I'm sure this guy gets asked this by every single client, can I have a go on the dozer? And every time he comes in he says yes. He's no intention of letting you and I do it, Laurie, has he? Laurie, speak to me. They can't hear you. Oh, that's blissful, actually. That's quite nice that they can't hear you.
Okay, now I'm back, so everyone can hear me as well. And we've actually changed. So what is going on in this, Simon? This is a bit odd to understand if you don't really know what you're actually looking at.
Okay, so we here are looking at a drone shot of the centre from Laurie's drone, which he puts up above it. And what we've done is we've taken the drone shot and we've superimposed the buildings we're actually going to have on there. So if you look to the right hand side of the screen, the blue building, that is going to be Sally's new domain. It's like a palace. We've built Sally her own palace. And then on the side of that, all the orange things are the pens. So there's lots of area. That's where our veterinary work will actually take place. And hopefully we will have a commercial veterinary practice next door to the wildlife practice. So that would encourage more vets in to come and help us. And then as you go past that little sort of line of hedgerow in the middle of the picture, we go on to the visitor centre and the security room and the workshops and the sheds, because we have to do so many repairs all the time. And then as you go down, further down the screen, that's where the big lakes are starting to happen. I'm sure Laurie's got a picture to follow this one, which will show us a bit more of the lake construction going on. So there, the dozers going round, the diggers doing their digging, and I think later on you'll see a bit of a wider shot and you can see how it's beginning to form up. It was quite staggering. I mean, for me, it was very emotional because we bought this site 7 years ago and we've been talking about it and talking about it and talking about it, and nothing's happened. But when we saw that first digger bucket go in the ground, you actually begin to realise that it is going to happen. So these things at the moment, and it's weird because they have to take all the topsoil off and put it in a huge pile. Then when they've done that and they've finished all the work, they put all the topsoil back. So to me that's an incredible waste of time, but I can understand why they've done it. So the lakes are being formed now. I don't know if we've got a shot of that, Laurie, anywhere of the 3 lakes being formed.
We do. Just give me 1 second to try and put that in.
Laurie wants time now. He can't do things on the... You used to be so good at this, Laurie. I think age is hitting you as well now. So he's trying to find a shot.
Age is always hitting me. Age is always hitting me.
You really look at Laurie as well. You really look nearly as old as I do now, which is quite scary. I'm sure Laurie will find it, so I'm trying to talk over the top of it. But I mean, basically the 3 lakes are being formed, and what we do, we dig out the lakes, we go down below the clay layer to get the levels we want. Then again, the clay layer comes back in to line the ponds. The idea of this clay is that we'll literally line the ponds, so when we get the water in them, the water won't then escape. The only trouble we've got in the summer, if we get a very hot summer like this year, is that water evaporates, so we are going to have to keep them topped up. We're allowed to take a certain amount of water from the river every day, and hopefully that will be enough just to keep the ponds topped up. We've got 3 ponds, so each will feed into the next one, and then when the water is overflowing, whatever, it will go back out into the river. So we're not actually taking from the river, apart from the very first time. We're then putting the water back into the river as we go. You didn't find that picture, did you? You failed me, Laura.
I'm currently working on it. I believe the most up-to-date ones are actually still on the drone and haven't been sort of moved over into the system that we're currently on.
I'm going to get Sally to be head of media, head vet, and head of everything else. She'd
probably do a better job, let's be honest.
She would. Laura, she'd certainly do a better job than I do. I mean, I just make it up as I go along, you know that.
Yes, that is true. That is scarily accurate, I'll be honest. That is scarily accurate.
Make it up as you go along. I've been doing it for 69 years and it's worked so far. I haven't been found out. I'm worried that Sally's nodding.
It's true.
Sally's nodding at that.
It's true. Sally knows exactly what exactly what it's been like.
So, I know Sally's got loads to do. We've kept her for 25 minutes. Any other questions for Sally before we let her escape back to the treatment room? And I hasten to add, she's not supposed to be on duty tonight. So yet again, her 5 o'clock end is going to be probably, I bet she's still here at midnight. I'll send an email around tomorrow.
Our badger with the rump wounds though, he's pulled a couple of his sutures out from his dressing, so I've got to knock him out and...
So what are the big patients that we've got in at the moment? What are the sort of perhaps the not exciting ones to you, but the most challenging cases to you at the moment?
Well, so I mean, obviously historically, Mary would, when I was part-time vet and auxiliary, Mary would obviously do all the sort of the bigger cases. So I've got a crow at the moment who's a fledgling, and he's got a fracture in one of his long bones in his legs. So he's got a splint, so I need to do a dressing change because corvids like to splash about in their water, so whereas a nice pigeon would keep his dressing on for 21 days quite happily, he keeps on getting it wet, so every 3 or 4 days I'm having to redress it, so I'm going to redress him later as well. We've got a badger who is an older badger but not end of life old, so we're having a go with that one, and he's got the very typical sort of face, neck and particularly rump wounds, so they look really horrific on admit, but they're really quite satisfying as I'm learning. So my plan had been to leave dressings on for 7 days, but by day 5 there's either ooze or something that requires a dressing change, so we're doing a dressing change on that.
And the other quite interesting case for you must be that owl that came in, because we had an owl in with a broken leg, which Sally can tell you more about, but she was a bit unsure of doing it. The first one's always a tricky one for anybody because you've never done it before, but you took it up to Hamilton referrals, didn't you? How did that go?
Yeah, so we had a tawny owl in who had a fracture in one of the long bones of his leg. And so we knew that we needed somebody who could do an orthopaedic repair. I did try to reduce the fracture, and although you think, oh, it's a tiny owl, it's going to be really easy, this part of the leg is quite well muscled. I have, you know, I take my hat off to the orthopaedic surgeons who do this sort of thing in humans and in large breed dogs, etc. Because frankly, in a tawny owl, even in a tawny owl, it was difficult to, we call it reducing the fracture, when you pull the bone when it's displaced back apart and actually realign it. I managed to pull it back, sort of, but I couldn't actually then make the ends align. So I splinted it just to stabilise it, because that reduces an awful lot of the pain and also reduces the chance of further soft tissue damage. And then thankfully, because Simon has built up relationships with lots of wonderful vets over the years, he has a relationship with
everybody.
Everybody. In this case, Michael and Claire Hamilton, who have their own practice, and they also have their own referral practice. Michael very kindly agreed with his wife Claire that we could take the tawny there to have a repair. So this tawny owl had a European board certified orthopaedic surgeon fix his fracture. So he put some, I think the original plan was probably to put what we call an intermedullary pin, a pin inside the bone itself, but there wasn't a pin small enough at their practice, so he basically put what we call an external fixator on, which is where you drill some nice sort of hard sort of screws into the actual bone itself, and then you make a bridge across the top, and then you put putty over the whole, sort of a quick setting putty, which is what you can see over the top.
That's what we can see at the moment, yeah.
And that holds it together. So the idea is you've got a couple of pins driven into the bone on one side of the fracture and a couple on the other, and that will then stabilise the fracture. So there's our lovely post-op picture showing that the bone is perfectly aligned. He did a fantastic job. The entire team there was so kind, so welcoming. Honestly, I can't sing their praises high enough. And bless them, the anaesthesiologist Christina and David, who did the actual fracture repair, they had already been forewarned that they were having to squeeze a tawny owl in at pretty much short to no notice, and they were also informed by their boss that me and somebody else were going to be there, but they weren't told that actually we were probably going to film it too, and they were so accommodating, so wonderful, and answered all the questions that I had for them. They were absolutely lovely.
So it's always useful. I mean, nobody knows all the answers. I mean, even they don't know all the answers. In fact, I think the guy who operated on the owl had never operated on a bird before.
He'd done one bird before. He'd done, I think, a ring parakeet or something, he said.
So it's all a learning curve, and I mean, I always say to anybody who comes in here at any level, the day you think you know it all, leave, because you never will, and the day you don't enjoy it, leave, because there's no point being unless you've got passion for it, because if you haven't got the passion, you can't possibly put in the hours you need to put in with the enthusiasm you need to put in. I mean, we've had to actually staple Sally's face with a smile on it tonight, so we look as if she's enjoying it. I mean, that's an awful lot of Botox in there to keep her smiling.
Botox.
It is terrible. Sally, we've got lots of questions for you. Have you got another 5 minutes, or do you want to rush off?
Fine.
She's got 5 minutes, Laurie, so scream a question at us.
Carry on.
Are there any procedures for wildlife medicine, or do you need to invent your own? You can answer that one, though I know the answer.
I mean, there's people who sort of do wildlife all around the world. There's no sort of formal things, but you sort of take a measure and take a gauge, as you would with anything else, of who you think you trust. And thankfully, the wonderful Maru, who was here before, put lots of procedures in place for us, which, whilst I try and get up to speed, I am following to the letter as much as I can. Of course, there are things that aren't in her sort of the protocols, that guidelines that she made for us, which I'm trying to work out myself on the fly. There's a lot of research every night, but I think, to be honest, if you ask every vet in any practice, whether it's wildlife or domestic, there's the things that you see time and time and time again. You know, in domestic animal practice, it would be your vomiting or diarrhea dog, or cat, very common presentation, and you sort of almost have a hit list of things you can do in order. And certainly, if you see a lesion in a mouth of a pigeon, you're like, well, is it canker? Because that's a really common presentation. There's other things it can be, but the first thing you're going to do is swab it and see if it is. But then there's, like I said earlier, there's all the things that you've never seen before. We had a frog in a couple of days ago who has, as I like to call it, some kind of right eye badness.
Right. That's a veterinary term. Is that the new veterinary term?
That's my provisional diagnosis, is right eye badness. So I've been consulting with the wonderful Sarah Fisher, who does a day a week here at the moment. She's excellent. She's sort of always on the end of the phone for me
Cool.
to find out what's going on.
I'm just staring at a huge hornet flying around the office. If it comes towards you, I'll let you know.
Oh, don't worry.
There's another question, Laurie. Give me one more question for Sally before she has to go. Is there any animal apart from Simon that you'd really love to treat?
Oh gosh, that's a good one. Do you know what I did before? When I was living in Australia when I made the decision to sign up to be a vet, and because I'm older, I was thinking I need loads of really cool stuff on my CV to differentiate me. And so, as much as I don't like zoos, and I think Simon will agree with me there, I thought I probably should get a month experience at my local zoo. And then I realised that actually I was also near Steve Irwin's place, Australia Zoo, and I didn't realise that he had Australia Zoo. He had the wildlife hospital there because his mum was an original rehabber. And so I was very fortunate to sort of wheedle my way in there and work with them. And I got to say, as a vet, one of my things that I really still want to do is, as a qualified vet, one day I'd love to go back to Australia, work with year flying foxes, which are bats, and with the koalas and all of the other wonderful things I saw at the wildlife hospital, but actually as a vet rather than as a hospital auxiliary. Your possums and all that.
I can never understand anybody who goes to Australia and then comes back. I mean, I loved Australia, I loved Tasmania. It's so beautiful out there, and it's fascinating. I mean, we really are a load of wimps in this country. I mean, we've got very few things that kill you, apart from Alice when she's in a bad mood, and that can be fatal, I'll tell you. But yeah, we get it easy here compared to them. I mean, when I went out into Australia and filmed, and in Africa as well, I mean, so many things can do you very serious damage. But I mean, to get out there and then come back here to this weather, okay, lovely at the moment. But yeah, Australia every time. If I'd gone out to Australia when I was very young, I think I would have stayed there and not come back again.
Well, we had permanent visas. We were going to stay over there, but my partner works with Americans, and so I had a great time. I just never saw him because he worked through the night every night.
Well, I've just cancelled your visa because we don't want you going off to Australia, Sally. One more question for Sally before she has to run, Laurie, because she's getting twitchy here. What's the most challenging thing about being a wildlife vet? And you can't say Simon. That answer is verboten.
What's the most challenging thing about being a wildlife vet? I guess I think that probably the most challenging thing is that, like I was sort of alluding to earlier, that whereas with sort of your domestic pet species, there's a hell of a lot of research into pretty much all of the common conditions. There are clinical trials, clinical studies. A lot of stuff that we do is much more experimental in terms of, I've not seen this presentation